From 2000 to 2015, more than 500,000 people died from a drug overdose. 91 Americans die every day from an opioid overdose, according to the CDC. Mortality rates due to heart and cancer illnesses have decreased, but mortality rates overall have increased due to these drug overdoses. The majority of people have been prescribed some type of pain pill in their life due to an injury they sustained or a health issue. But were they made aware of the dangers of addiction from these prescribed drugs? The number of prescriptions for opiates like hydrocodone and Oxycontin products have escalated from around 76 million in 1991 to nearly 207 million in 2013, per the National Institute of Drug Abuse. In correlation, death by accidental overdoses of opiates have quadrupled since 1999. In recent years, we have seen a slight decrease of deaths from prescription opiates, but with the decrease, we have seen an increase with heroin overdoses and synthetic opiates such as fentanyl. Drug use for medicinal purposes can be seen for thousands of years. Heroin was once used as a cough suppressant. But to understand this epidemic, we need to only go back a few decades to where it all started. Doctors prior to the 1980s were aware and cautious of prescribing opiates, understanding that these drugs could be highly addictive. In 1980, a paper was written in the New England Journal of Medicine, a medical study done by Jane Porter and Dr. Herschel Jick, that looked at treating patients with chronic pain by opiates. Their study concluded that the development of addictions is rare in medical patients with no history of addiction. Slowly, people with terminal illnesses were beginning to be treated with opiates. A study was done 6 years later by another doctor in regards to pain management, Dr. Russell Portnoy, where he studied opiate usage among non-terminal chronic pain patients. He concluded that opiate maintenance therapy can be a safe, salutary, and more humane alternative to surgery or to not treating a patient with chronic pain. These studies started shifting the discussion of pain management treatments, opening the door to what we are seeing today. In the 1990s, pharmaceutical company Pharma introduced Oxycontin as a pain management tool. They pushed this through video advertisements that played in doctors' offices and ads in medical journals. After this, opiate prescriptions increased by 11 million. Years later, Pharma settled a lawsuit with the federal government for misbranding, not making consumers aware of this potential of addiction. In the early 2000s, the Joint Commission sold books to doctors sponsored by Pharma on how to help patients with pain management. One of the experts out of the book says that evidence that addictions is a significant issue when persons are giving opiates for pain control. It also called doctors' concerns about addiction and side effects inaccurate and exaggerated. This propaganda by the pharmaceutical company made doctors feel more comfortable with prescribing these medications while lining the pockets of the pharmaceutical company. Doctors are not innocent in this epidemic. A study by the American Journal of Public Health that looks at opiate payments to doctors showed that between 2013 and 2015, over 375,000 non-research opioid-related payments were made to 68,000 physicians, totaling over $46 million in payments. How is this not a conflict of interest? How can we expect doctors to decrease opiate prescriptions when they are being compensated for prescribing them? There's now a way to see how much doctors are being paid by pharmaceutical companies. A government website called Open Payment Data. This allows you to enter in your doctor's information and see payments that are made. I know there are doctors who are prescribing these medications because their patients really are in need. But when money is a factor, it overshadows those doing good for those making a profit. The influence by pharmacy companies goes even deeper, impacting research and teaching. 1,600 Harvard professors stated that they or a family member have ties to drug companies that could bias their teaching or research. The pharmaceutical industry donated more than $11.5 million to Harvard in 2008 for research and continuing education classes. Opiate addiction is not just killing Americans at a dangerously high rate, but the impact financially to the economy is devastating. It is estimated that the non-medical use of opioid pain relievers costs insurance companies up to $72.5 billion annually in healthcare costs. This social issue is even worse. Too many parents are losing sons and daughters, children being left without parents. To try to combat this epidemic, law officials in Ohio have been trying to bring light to this issue by going as far as publishing crime photos. One of those were a picture of two parents who overdosed in the front seat of a car while their child was in the back seat. Luckily, they were able to save both parents with Narcan, which is a drug used to reverse the side effects of opiate overdose. This is a sad reality to what law enforcement is seeing on a daily basis. The current administration has declared that the opioid crisis is a public health emergency, which will waive some federal regulations and give more power back to the state on how they spend their money to fight this issue. Some lawmakers and health groups do not believe that this is enough, and that he should have requested emergency funding from Congress. America is hemorrhaging lives by the day because of the opiate epidemic, but President Trump offered the country a band-aid when we need a tourniquet, stated Senator Edward Markey from Massachusetts. Only time will tell if this declaration will make a difference, but it does nothing to address the conflict of profit being made by pharmaceutical companies and doctors at the expense of its citizens. Pharmaceutical companies should be about helping people, not about making profit.